Well, for more on the immigration debate, I'm joined by Julia Gelatt. She's a senior policy analyst at the Migration Policy Institute. Julia, thank you so much for joining us. Now, this new rule that the federal judge blocked in Oregon, it would have required migrants coming into the United States to prove that they would have health insurance within 30 days of arriving, or that they had the financial means to cover any sort of medical costs. But it was widely seen as the Trump administration's attempt to further limit immigration. Does this ruling change that course at all?
So what the ruling does is it puts this new policy on hold for 28 days while the courts consider the merits of the case. So this will continue to be debated in the courts.
Do we know who these individuals are that would have been from the, I think it's 375,000 people that potentially would have been impacted by this? Do we know who those people are? Are they low-income people who cannot afford medical coverage to begin with?
Right, so this new policy would have affected everybody applying for a green card from abroad, but we think the majority of people who would have been affected would be family-based migrants, those who are being sponsored by relatives in the United States. And yes, it seems like one way they might implement the policy is through an income test, through looking at the means that people have to cover any necessary medical care in the United States.
I mean, this isn't the first setback that the Trump administration has sort of faced in the last couple of months. I think it was just last month that the public charge rule that would have denied green cards to people who use public benefits, that was blocked as well. Does this give us any insight on how this whole immigration issue is going to work its way through the court system?
So what it seems like is that the Trump administration is trying to use executive powers to really change our legal immigration policy. And so far the courts have said, we want more time to consider these policies, consider the merits of them. And so we're going to block these policies while the cases work their way through the courts.
The Kaiser Foundation put out a study, and they said that legal immigrants are 3 times as likely as American citizens to be uninsured. So is there any sort of validity to the Trump administration's claim that these are people that are going to be a financial burden to the healthcare system here in the United States?
It is true that legal immigrants are less likely to have health insurance coverage than citizens. At the same time, they're a really, really small share of the uninsured population in the United States. So the vast majority of uncompensated medical costs are coming from U.S. citizens, not from new legal immigrants.
So if they wanted to continue moving in this direction, it's about changing the actual law itself, right? Is that the way they would have to go about doing it?
You could make the argument that big changes to our legal immigration system like this, changes that would exclude up to 2/3 of legal immigrants from abroad, really should be done through Congress, through a debate with the American people, a debate in Congress, and our normal legislative process.
I wonder if sometimes this is actually a good thing, that these type of sort of extreme executive orders coming out of the Trump White House that then work their way through the systems, we get precedent being set. Does this at all tie their hands going forward?
I really think we'll have to see. I mean, we saw with the travel ban that affects some Muslim majority countries that the Supreme Court did allow that policy to go forward. So we'll have to see what happens with the public charge and with this health insurance proclamation cases.
All right, Julia Gelatt there, senior policy analyst at the Migration Policy Institute. Thank you so much for your insight.